So we have five firms that are here today, and the first is ClearView Healthcare Partners. Kai, would you like to introduce yourself, share a little bit about what your firm does, and one thing that you find most rewarding about working in healthcare consulting?
Wonderful. Happy to. Thanks, Jenny Ray. So my name is Kaming Pu, Managing Director here at ClearView Healthcare Partners based in our Boston office. For those that don't know, ClearView, we're a life sciences strategy consulting firm, founded, I think, in 2007, now with a presence in Boston, New York, San Francisco, London, and Zurich as well. Our organization, primarily works with a mix of biotech, pharmaceutical companies, as well as medtech and investors in the space. We can talk a little bit more about some of the types of questions we tackle, but it's a pretty broad range, ranging from the smallest pre-commercial single person companies, to the biggest of the big, large pharmas. The types of folks we're typically engaging with, sort of range from, the C-suite all the way down to sort of brand owners. And then in terms of the talent, we have, 98% of the folks at our organization have some kind of life sciences background, whether that be undergraduate, advanced degree, as well as sort of MBA backgrounds as well. In terms of the thing I personally find sort of most rewarding about life sciences consulting is I was originally somebody who was going to go to medical school, sort of way back in the day, and ended up sort of transitioning away from that path. And what really convinced me to do that was working at an organization like mine, getting to see sort of every day, like the innovation and sort of being really on the forefront of that, where the themes that we're sort of seeing every day, the questions that we're tackling are things that we start to see in the clinic and impacting patients' lives. And not 1 or 2 years, but 6, 7, 8, 9, 10 years down the road, and starting to see some of those things come to fruition has been incredibly rewarding, and very exciting to me, and something that gives me, a lot of hope for what's to come in our industry.
Hi, we're so excited to have you. I certainly can relate to your background. I too am formerly pre-med. I feel like there should be some badge on us somewhere, right? That says like
Yeah.
that was what we did. And I love that you found a way to apply your passion for so many interesting and varied use cases. Thanks for sharing. Greg, we'll go to you next. Health Advances. Can you share a little bit about yourself, your firm, and also something that you find really rewarding about your work?
Sure. Hi, everyone. Greg Chittum, partner at Health Advances, and as of today, managing director, leading our commercial and growth activities for the firm. And I work in our health IT, digital, and medtech practice. I've not been a lifetime consultant, although I started there and am there now. I was most recently spent about a decade as a product manager and head of strategy and marketing for Arcadia, a population health software company based here in the Boston area. And prior to that, I started my career with Monitor Group, which is now part of Deloitte, doing generalist consulting, mostly for biopharma and high tech. And have an engineering and business degree from Dartmouth College. And Health Advances, we're a firm, we've been around for 30 years, founded by two Bain partners who were married then and are still married now. And leading the firm. We work across not only biopharma and biotech, but also have large sectors in diagnostics, life sciences research tools, and then digital health IT and medtech, with offices like many in Boston, but also in San Francisco, Hong Kong, and Zug, Switzerland. And I think the thing that I find most rewarding, in addition to really working with a wide range of companies from relatively early startups, maybe having just taken their first professional money, but also some of the largest companies in the world, not only within the sectors I talked about, but we see a lot of the fun and the opportunity in the cross-sector work. So thinking about the intersection of how pharma companies are using digital tools, or how we're bringing devices into clinical trials, is really what I find the most interesting.
I love that. Have you been to Zug?
I have.
I have
It is
too.
a beautiful little town.
It is a beautiful. We need to put up a poll. Fun fact: so I did a house swap with somebody in Zug. They weren't in they weren't in the healthcare space or healthcare life sciences space, but what an interesting roster of clients and also locations. So thanks again for sharing a little bit about Health Advances. Can't wait to learn more about y'all today. L.E.K, Lane, thanks for joining us. Tell us a little bit about you, about L.E.K, and also about something that you find particularly rewarding about your work.
Sure. Happy to be here. Lane Anderson. I'm a managing director partner with L.E.K. I'm based in our Boston office. I've been with the firm since 2005. I actually started out as a generalist, did not have a science background. I came to L.E.K. and worked across a range of industries. Ultimately gravitated towards life sciences and biopharma for a number of reasons, which I'll get to when I come to what I like most about working in that industry. A little bit of L.E.K. We just recently had our 40th anniversary. We were founded originally in 1983 in London. We're now more than 20 offices around the world. Healthcare is a big end market for us. We also cover substantially industrials, consumer, TMT, financial services. But healthcare is our biggest area. It's where I spend all my time, and in particular with biopharma companies. But we also work across the spectrum that were mentioned today: diagnostics and tools, and med tech, healthcare IT, payers, providers. Pretty well cover the healthcare spectrum there. So to the final point, actually, one of the reasons why I got into biopharma and stuck with that versus some of the other areas I was exposed to as a generalist is ultimately because of the passion and the energy that the clients bring to what they're doing. And I think that rubbed off on me and brought a lot of energy and motivation to the job. So I can recall sitting in those boardrooms and with the executives and that level of a passion and excitement they have really pushed me to want to stay in the industry and help them realize some of their lofty dreams and ambitions.
Incredible. I love it. Lane, this will be a question. I'm just going to ask you one quick follow-up now, just because I think people may wonder, when you join L.E.K, do you join a practice or do you join the firm and work across practices? Just you mentioned just a little bit of your taste of kind of how you found your way. Can you just share a little bit about that? I think that might help a lot of people understand a little bit more.
Yeah, so the majority of people join as generalists, but there are exceptions to that. So we hire predominantly out of academic programs, undergrads, PhDs, MBAs. We do some lateral hires or people with experience already. But the majority of people come from undergrad, MBAs, and PhDs. So the PhDs would come in directly into our life sciences practice, but the undergrads and the MBAs predominantly come in as generalists. And then once you're in the firm, you can select into one of our sectors. And a lot of people will do that for a 6-month rotation and then decide to stay in that or rotate to another industry and market for the next 6 months.
Love it. Okay, great. Thanks for that clarity. Wonderful. We're so glad to have you. Thanks again for joining. Stacks and Rob, welcome. We're excited to have you here. Again, just can you please introduce yourself, your firm, and something that you find rewarding about working in the field?
Yeah, thanks, Jenny. My name is Rob Larson. This summer I will have been at Stacks for 7 years, and previously I worked in private equity investing, corporate strategy consulting at Monitor Group, also like Greg, before they were acquired by Deloitte. And then I also work in industry as well. Similarly to other people, I come from a non-healthcare training background. I was actually a physics degree, but I come from a family of doctors and dentists. So I think you never fully respect the things that your family does, and so I always looked at healthcare as how can it be changed and improved rather than this thing that had to be kind of admired from afar. And so I think that's what made me gravitate towards wanting to work in the industry, at least and trying to help change things a little bit and improve on it. A little bit about Stacks. We only do private equity consulting, and so that's commercial diligence for private equity investors looking to acquire companies. We'll do growth strategy and value creation while they own them, and then we'll do sell-side market reports when they're getting ready to sell them. Stacks, we look at all industries, but healthcare is our second largest alongside tech. And within healthcare, I do exclusively healthcare, and along with we have a healthcare group that does that. And the areas, typical areas we'd be looking at is everything from like roll-ups of physician practices and other practices like dental, vision, physical therapy, staffing and services to hospital departments. It includes software for practices in hospitals. It includes pharma services, so that would be software and services for clinical trials, regulatory approvals, drug launches, commercialization, and then also med tech and contract manufacturing. So pretty much the gamut, except for the one thing we don't do is dive into the science to understand a particular molecule for a new biotech firm. But all the
that's the only thing. Everything else you do.
Everything else so far is. Seems to be within scope. The private equity does, I should say. There's a lot in healthcare that private equity doesn't do, and so we're limited to the private equity world. And then As far as the most rewarding thing about my job, I think it's getting to think like an investor or an owner of healthcare companies, finding ways that companies can improve and sharing that with the people that have the motivation and the funding to actually make those changes, as opposed to just kind of, submitting a report and maybe it just sits on a shelf. And then I think, and really working to help shape healthcare in a small way to both be more profitable as well as better take care of patient needs.
I love it. Great. Well, thanks so much for joining. I love that background too. I wonder if you do appreciate the things later. I'm wondering that for my kids now, right? Will they appreciate the things that we've done? Maybe not at the moment. I have some rising teenagers. This is concerning for me. Awesome. Last but certainly not least, the Cormack Group. Todd, would you please just introduce yourself, introduce Cormack, and also what do you find rewarding about working in healthcare consulting?
Will do. So Todd Snell, I'm a senior partner at the Cormack Group. I've been there for a little less than 2 years and lead the med tech practice, as well as life sciences for Cormack. Prior to Cormack, I spent 25 years in executive roles, both in biopharmaceuticals and medical technology. And like a few of the panelists on the call, I'm not a practicing medical practitioner. Primarily been an engineer and MBA my career. Although I will say on a funny note, I have been practicing somewhat medical as a ski patrol over the past 5 years. So my medical experience is coming up pretty quickly on every week of going out and helping people that become injured or wherever else. From a Cormack perspective, the Cormack sort of role or where we fit in the industry, we are focused on a number of industries, and we are building our med tech and life sciences practice. We're a small firm that tends to go in and look at either regulatory affairs, regulatory compliance, and quality assurance type challenges, as well as operational manufacturing supply chain challenges. And what I really love about what we do at Cormack is we're coming in on a strategic and a tactical level to really address issues. And those issues are usually affecting a patient at the end of the day, meaning it's a disruption in product, or we're not getting things out as fast as we can to eventual patients. So I love the fact that the mission of Cormack is out there, quick projects, go in, small firm, and fix things that need to be fixed in firms that maybe those firms at times may not have the capability and capacity to really address some of those issues. My reason for being in healthcare consulting, honestly, my whole career has been in healthcare. And especially from a med tech and biopharm perspective, every place I've worked in my career, whether it was GE Healthcare, Genzyme, Medtronic, Fresenius, NextStage, all those firms, interesting enough, I had a family member or friend who utilized those products. And some of those products are life-saving, some of them are quality of life improving. And so there's a real personal connection now to being able to help to continue to bring the great products we have to patients that need them. And so that keeps me going. And I love being able to help firms, both as an advisor, as a coach, and as a partner at this point.
Amazing. Todd, thank you. All that I heard from that background of the panel is A, y'all are awesome. And B, if we were on a plane and we had a health scare, Todd is the only one that could actually do anything. Is that, am I right about this or am I wrong? I don't,
There's definitely some limitations, Jenny. Let's not go too far. CPR.
That's amazing. Well, again, we're really excited to have you. I think we're going to have a lot of different colorful perspectives on the industry today. So we've pre-selected a few questions. I'll ask in general if you're able to. All of you are very well spoken and clear. I don't think this will be an issue, but just to keep your answers to around 2 minutes so we can kind of keep color and keep things moving on. And I've pre-selected both questions and also a few people to answer something. If at the end of this block of questions for my panelists, there are questions that you feel like you had a burning answer for and a perspective that wasn't shared, then I'll offer that to you to come back and include that. But we'll move on now to those moderator questions. The first one is just, what is the main challenge your firm is hired to solve? So a lot of you talked about who your clients are, and Todd had touched on this a little bit with, right, supply chain issue, et cetera. But what's the challenge your firm is hired to solve, and for what type of client? So Lane, Rob, and Todd, if you would respond to this question, that would be great.
You want us to go in that order?
Sure. Let's keep it sorted out. Why not?
Yeah, so I would say that we're typically hired to define and execute corporate strategy. So that can come in a lot of different variations, but ultimately comes down to some of the key strategic choices that firms face as they go through inflection points. So we work with biopharma companies from small to large, and depending upon where they're at in their development, if they're moving from clinical stage to commercial stage, they face a lot of key strategic questions and strategic choices around fundraising, around entering new geographies, launching new products. How to spend their limited resources has been a pretty big topic the last few years. So they've got a great scientific platform. Where should they point it? Which indications, which programs should be advanced and disproportionately invested into is a big area for a lot of our clients these days.
Amazing. Love that. Thanks. Stacks, what about you, Al?
So for us, we focus on private equity investors, and so the main problem we're solving is the availability of data. Private equity typically focuses on niches within the industry where there aren't existing data reports. They don't have investment banking analysts that are creating, they're projecting whether stocks are going to go up or down by a tick, and so consequently, typically there is no data. And so we create that. We're going to we'll look at a company that they want to invest in, and we'll interview their the customers, the suppliers, we'll survey the patients, we'll talk to the competitors, former employees, and based on all that, we'll create a picture of the company's local market and how it's likely to grow over the next 5 to 10 years, and how the company's positioned within that market. Who are the main competitors? Is our company better or worse than the competitors, and in which ways? What are their advantages and disadvantages, and what levers can we pull to improve the company, and which of those would be easier to pull, which would be harder to pull? And that tells our clients how much they can bid to try to buy a company, and then where they can create value after they buy it.
Rob, it's not a sexy tagline, but the availability of data is maybe the clearest way I've ever heard just all of what consulting does described. It's very appropriate. So I wrote that down. I love that. Thanks for sharing. Last but not least, Todd, what about y'all?
As I mentioned before, we're really focused on small, mid-size biotech, pharma, and med tech companies. And where we really come in is we work with the senior leadership team, and we are really focused, believe it or not, on profitability and how do these companies survive increased regulation, increased scrutiny from places like the FDA, reimbursement pressures, and saying, how can we help streamline the organization to stay competitive, but also continue to serve patients?
Love that. So what I love is that all of a sudden, right, we heard everybody was serving not only different clients, but also solving different problems inside the space. So that creates a really interesting picture. Amazing. Let's move on to the second question. I feel like the others of you might want to jump in on that one when we come back to it if we have time. But just to keep things moving, what is a growth opportunity in healthcare consulting in the next 5 years? So Kai and Greg, if y'all would answer this.
I'm happy to go first, and there's a couple of big ones. I think one of the big ones though, and is honestly related to how do we as an entire industry leverage data, right? I mean, think Jenny, you alluded to consulting being the lack of data in some cases, but one of the unique things that we have in the biotech pharma space in particular is honestly a wealth of data, right? Whether that be patient level, physician level, or even data on specific molecules and programs. And how do you sort of sit at the middle of all of that and sort of try to integrate and combine those pieces? And everyone likes to say they have amazing data, but no data set is perfect, and in fact many of them are really messy. So that's something that I think.
Who says that, Kai? Who says they have amazing data? Lots of data, true, but amazing data. I don't know. Yeah. I haven't heard that one very often.
No, I think that's absolutely something that's going to be an opportunity, and but also a challenge, right? I mean, how do you, that exact point, figure out what is the right data set and the best data set to apply, and what is a specific question you can interrogate a data set with?
Love it.
Yeah, it's somewhat of a similar answer. And I think this both goes to what the growth opportunities for consulting as a whole are, but also one of the ways that you as future consultants can really stand out and succeed in the long term is really thinking about how do we, the cliche is that consultants, we're all going to be replaced by ChatGPT, 12.0 at some point. But I think that's a great opportunity.
Are you going to get replaced, Greg?
Well, yeah, I mean, some part of my job is, I hope some part of my job does get replaced. And I think for all of you, I think coming in, understanding why that's true and also why it very much is not true, and being able coming in with skill sets around data analytics and data analytics in all ways. It's not just about can you run a SQL query, but it is really understanding how you can pull data out of structured data, unstructured data, public data sets, private data sets, expert interviews, surveys, and bring that all together to actually drive some real insight. That's something that we're a long way away from ChatGPT doing, but it's something that we need to be able to do as firms and as individuals.
I love that. Smarter than ChatGPT, right? That's what we need to do. We hope, right? Yeah, seriously. If we're not, then we're in other kinds of trouble. Awesome. Well, speaking of technology, my next question is around technology. So let's talk about how your firm is leveraging it today, ChatGPT or otherwise. So data sets, technology, et cetera. How are you leveraging technology for your clients? Todd and Lane, if you could take this one, that would be great.
Yeah, I think in our space, we're really looking at how can we tactically implement AI in more of the FDA regulated processes. So all of our firms are FDA regulated. And for those who've been close to those types of processes, a significant amount of validation and auditing and scrutiny from agencies, and very headcount intensive. So how can we actually streamline for companies processes that really lend themselves to way with AI, and how can we be in the forefront of sort of putting that in front of the regulatory agencies?
Yeah, and from our side, I think a lot of it, our clients have acquired technology and data, and they need our support in helping getting the best leverage out of that. We are technology agnostic and data agnostic. We're comfortable working across the board there. And I think a lot of times when our clients go to a data vendor and say, I have a problem, they try to sell them an additional module or additional set of data. And we can actually come in and say, well, here's something you can do internally, or here's how you can use the data differently, or think about a different data set or a different technology vendor to solve that problem and that unmet need. So I think that's where a lot of the pain points come for us.
So offering that advisory layer outside of technology actually is powerful. That's good. I can definitely attest to that as a business owner. Every technologist has another widget that they'd love for you to buy, but sometimes you don't know how it fits or overlaps with your
Yeah, there's a ton of data out there, right? I mean, if you look at claims data or otherwise, you can get it from the government, and they're massive files. But if you don't have any ability to manipulate it or leverage it or draw insights from it, then it's not very valuable.
Love it. My fourth and final question from the moderated section is for advanced degrees, such as PhD, MD, or healthcare professionals, such as physicians or bench scientists, looking to broaden their impact. What are 1 to 2 advantages of moving into consulting? So we'll do this one, Rob, Kai, and then Greg.
I think for me, so I have empathy for this question, having originally getting a degree in physics, and so I looking to thinking about should I stay at the course of scientist or should I get into business? Ultimately, decided to get into business, but I think the main advantage to taking this path and going down the consulting route really is the ability to impact organizations from the top down. I think it's easy a lot of times for practitioners to find creative solutions which seem theoretically should work beautifully, but don't seem to get adopted by organizations. And often the reason why is because the solution isn't as economic as you might think, or it's not as practical as you think for reasons that you're not fully comprehending. And I think consulting, it trains you to think like an owner, think like really think through the economics and the motivations and the dynamics, and so that you create solutions that can be adopted from an organization from the top down and actually move the needle, and make a difference.
Very much agree with everything Rob just said. The other thing that I think about when I was in sort of all of your shoes is not really having an understanding of what is out there necessarily, right? And while I hope that anyone who joins ClearView, and I'm sure for the others, any of your firms that you're lifers and you stay there forever, I think you realize the practicality is that's not going to be the case, but the breadth of exposure that you get, even within something as specialized as life sciences, just being able to see different companies, different therapeutic areas, different technologies. Getting to see all of that in a relatively short time frame, I think is invaluable to helping shape and helping you understand what else is out there and what are the types of things you could be interested in doing if it's not consulting, for forever. So I think that's not something you can replicate anywhere else. And one of the big reasons why I advise folks on choosing consulting over other industries.
Yeah, and I think with our firm, because we've put so much emphasis on cross-sector work, I think that's the PhDs that come to work for us. That's one of the things that we hear over and over again is I loved getting really deep into a single subject as a PhD, but one of the things I'm looking for is not only getting away from the bench, but also really being able to think across sectors and think about the intersection of not just the molecule that I was working on, but how we actually have a companion diagnostic to get that eventual drug prescribed. So I think that is certainly one, and you can't do good cross-functional work unless you're deep in one of the sectors. And so I think that's why that balance is really important. And then I think it's also, the other thing that's really that we hear over and over again is actually getting to see the real application and adoption of what we're working on. And it's not, you're not looking in 10, 20, 30-year horizons. You're actually doing commercial strategy where you actually are going to see whether it works or not. Maybe not immediately. That's one of the downsides of being consulting is you're not actually doing the execution necessarily. But you are going to, at some point down the road, you're going to see the commercial or you're going to see the clinical results. You're going to see some actual result, which I think is a strong advantage moving away from a PhD program in particular.
Well, I think all of those were amazing answers, but now that I also know the background of everyone on the panel, I feel like I'm going to add one more at the end of this moderator section, which is what if you're not a advanced degree that has a life sciences background, if you're not a healthcare professional, why should you still focus on this area? Why should this be a field that should be of interest to you? If you're one of those people, it's like, I want to live anywhere. I want to I'm open to doing anything. Why should people explore this? Many of you shared a little bit of your personal story, but you also have a bird's eye view. Does anybody want to weigh in on that?
I mean, I certainly can. And Kai may have the same answer since we started at the same firm a long while ago. And so I started my career in consulting for a generalist firm where I think over the course of 6 years, I probably worked in 12 different industries at least. And one of the reasons I actually thought when I went from consulting to industry, I actually didn't think I'd ever come back to consulting, particularly for that reason of wanting to focus. And so I think for all of us on the call, life sciences consulting is where we have chosen to focus our careers. And I think the reason life sciences and just healthcare consulting in general is that it's one of the few industries that touches all of our lives. Like, no one doesn't interact with the healthcare or life sciences industries. And so I think having that personal nature to it, I think is, at least for me, is really important and really critical, as opposed to another industry that you might not actually touch and you don't have that personal connection to it.
Everyone touches industrials, Greg. Okay. I know that's what you're talking about, that type of thing, right? The non-sexy industries that support our everyday life that we don't actually notice.
Yeah, the consulting I did for a mining company in the outback of Australia, it was interesting, but I had zero personal connection to it.
Yeah, love that. Anybody else want to weigh in on that one?
I'll offer up, it's just exciting. I mean, this maybe is building on what Greg said, but when I think about all of the different industries out there, I mean, other than, true tech, I don't think there's been an industry in the past 30 years that's seen as much innovation as the life sciences sort of broadly. And, you're getting to be a part of that and helping these companies that are on the forefront make those really tough decisions, right? If it wasn't a tough decision, they're not spending hundreds of thousands of dollars hiring consultants to help with that. And so it's just exciting. You get to see so much. And, even for individuals that don't necessarily have the deep scientific or clinical background, I think there's an appreciation of it. It's cool. You get to see this and you get to help shape the decision making in the future.
Incredible. Good. Last call for weigh-ins on any of those 5 questions in the first section. Anybody have a question that they wanted to lean in on that they didn't get to share?
I mean, Jenny, on the same points have been made by Kai. There's a real connection here to doing something in an exciting industry. I come back to before about this idea of impacting the patient and knowing that you're helping companies with technologies that are going to make a difference. I go one step further. We were talking about other industries. In the med tech and biopharm space, there's still a lot of room to improve from a management consulting perspective. Other industries have been hit harder over many decades with much more cost pressures and other things that when you look at med tech and biopharm, there's still a long way to go as far as how companies are run, how well they're managed, along with the innovations that are coming with it. So for me, there's an exciting part from a non-clinician perspective of helping these companies grow smartly and grow profitably.
Todd, is that an issue because of who founds them? Is it a maturity of funding issue? Like why aren't they as mature as some of the others in terms of that perspective?
I'll come back to something simple, product margins. I had a good friend start in the aerospace industry in aircraft engines, and those engines are being sold at a loss to secure service. So they're losing margin. You go to med tech averages about 40 to 50% product margins. No other industry in the United States does that except for biopharm, who in some cases can be in the 90s. So you've had companies run for so long with high margins that now are getting forced to be more profitable. They don't have that same pricing command they used to have. There's been reimbursement pressure. So I think there's a really big opportunity about how to help these companies grow more smartly that are already established on the market.
I love that. Great insights. Thank you all. I'll move now to the audience questions. I think this will kind of spice it up a little bit as well. Although I do have to say, you've all been quite spicy. I'm really enjoying the conversation. So let's keep that going. So the first one is just, are there any specific skills and or certifications that are especially appealing to employers in this industry? Todd, I think you pre-selected that one as one for you to answer.
Yeah, I think I would start off with, for each of the people on the phone is sort of 2 questions. One is, do you want to be a generalist or do you want to be a specialist? And I think it's a big question, especially going in the consulting space. And then the second question is, do you really want to operate at a strategic level and really looking at some of the bigger picture things that companies are facing? Or do you want to be more operational and tactical and actually more project work and work getting things done, let's say more at a management tactical level? So I think those are the big questions. And depending on where you land, is going to drive certifications or not, or an MBA. But my career has been pretty much generalist, but then over the years it started to specialize. So like a good example is in med tech and biopharm, if you want to work with the FDA in any way, shape, or form, there's a regulatory affairs certification that's super comprehensive. That's sort of your gateway into how to work with the FDA on submissions, on compliance stuff. So that's one path. There's a clinical certification. People want to run clinical studies. So a lot of these places have different functional specialties, but the question to everyone on the panel or everyone on the call is really, do you want to specialize in, or do you want to stay broad and be in a lot of different scenarios and challenges?
I love that. Todd, can I push on one thing that you said?
Yeah.
When you're the idea of like, do you want to be a generalist or a specialist? I think of times in my life when I probably would have answered both of those, but in different seasons. And I think sometimes it can be hard for people to diagnose that. Would you say that the bias is if you don't know you're a generalist, and also strategic versus operational if you don't know you're strategic? Or how would you figure that out, right? For a lot of people that are just like, I don't even know what I like, and I feel like I could love this, but I also might hate it. I have no idea. What do they do, and how do they figure those questions out?
It's funny. I have 2 daughters that are out of college now. We've had this debate recently, quite a bit on this generalization versus specialization. I mean, when I think of a generalist, I think of someone leading teams and leading impact and change, and being able to put anywhere, but their leadership skills, their influence, their project program skills are paramount. A specialist is going to rely more on their super technical skills. So if someone, you think of someone coming out of school or early in their career, do you want to be the expert, or do you want to be leading people through change? Do you want to be leading programs and projects? And then I think when it comes to strategic operational, are you excited about where the work gets done, improving that? Or do you really want to influence the big picture? The big deals that are out there, some of the big healthcare economic debates we have. And I think it's what interests you between strategic and operational.
What did your girls decide?
One's going way specialist and the other one's going way generalist.
Awesome. We'll have to check back with you in a couple of years and see how it's gone, right?
Please do.
I love that question. Rob, I'll move to you now. What's the most fun part of the job? Honestly, we've been so serious so far, right? Do y'all have any fun? Is there, do you like, I don't know. I'm imagining in CPG, right? Everybody gets, if you work for Hershey, you get to taste the chocolate, but like, how do you experience this industry in a way that's fun and engaging?
I would say it's definitely our expense accounts. No, just kidding. It's for sure. It's if you like solving problems, solving puzzles, then this is the ultimate puzzle solving profession. You're solving puzzles that impact people's jobs, their finances, and the life outcomes for patients. This is within an industry it's really among all industries in the world, healthcare is an industry that's most ripe for disruption. And that's because you have misaligned incentives, you have insurance companies, healthcare providers, and patients, and as well as all the other ancillary, pharma companies and other companies that together it causes it to not behave like a real marketplace because of the triangle directions of the way the incentives run, and it makes it very difficult for cost-saving innovations to merge, and which causes a stagnating impact on healthcare compared to other industries like tech, where things are always getting better and cheaper every year. But it also creates huge opportunities for creative solutions. If you can solve those inefficiencies, then you can really move an industry and make things better while also creating value. And so that's very exciting, is looking for those opportunities. And so within that context, we get to look at new companies, new niches every month. There's countless sub niches within healthcare, and then within private equity consulting, I get to explore new ones all the time, looking at a new niche and figure out how is that niche likely to play out, what the future is going to look like, which companies are going to win, which ones are going to lose, and within my target company, how can it improve its positioning, how can it get more economic returns, and hopefully make patients' lives better, and what's the best way to go about that. So it's in terms of it's solving puzzles and figuring out problems over and over and over again in new environments, and that's the most fun part of the job.
Sounds like the puzzles are never ending too. So that's
right.
Pretty interesting, right? You solve the one and then the next one comes. That's a good business model for consulting, by the way.
Yeah. Every other month there's a new niche that I'd never heard of before. Just last couple months ago was catastrophic claims management as an outsourced service to workers' compensation and insurance carriers. I didn't even know that it existed as a separate niche, and it turns out it has all sorts of dynamics that are totally different from the rest of claims management.
How amazing. Love it. Okay, thank you for sharing. Kai and or Lane, whoever wants to weigh in on this one, how can someone transition from clinical care roles to healthcare consulting? We talked a little bit about the value of doing that earlier, but tactically, right? And maybe you can also speak specifically from ClearView or L.E.K's perspective. Do they transition directly? Do you ask for them to have different work experience? Are you looking for clinical care plus something else on their resumes beforehand? Do you train them, et cetera? Can you just share a little bit about that? Kai, you want to go first?
Yeah, happy to. I mean, I would say, like just as more general advice for somebody transitioning, I think Todd was alluding to this, like kind of figure out where in the value chain, the sort of the stack that you want to ultimately sit, right? Is it on the provider side, the payer side? Is it within biopharma? There's a lot of difference across each one of those, and I think that would inform ultimately, how you tactically prepare for interviews and things like that. But explore those different areas, kind of figure out like what is most exciting to you, and then figure out how to sort of pursue that one more specifically. I would say for ClearView specifically, for those that are interested, most of our, I'll call it advanced degree sort of candidates, so anyone with a MD, PhD, we're doing primarily hiring through our Connected ClearView program that's sort of happening in the next couple of months. And it's pretty standard case-based interview process and do an immersion program. But we'll also sort of have other sort of avenues throughout the time. But for those that sort of aren't either on cycle for that, or maybe the timing doesn't quite work out, Honestly, like networking is probably the easiest way, right? Outside of sort of the normal typical recruiting timelines, getting connected to folks in the organization, understanding what's happening. Because, while the industry has certainly been facing some pressure, um, timelines change all the time, right? And sort of the needs for what we're looking for change sort of by the minute. And just because there's not a hiring opportunity this month doesn't mean it won't be there next month and the month after.
So they should just apply every month. Is that what you're saying?
Don't apply every month. Certainly not. But
Just checking.
yeah,
Okay.
look for the opportunities. For us, I would say the vast majority of our hiring does happen on a pretty typical cycle, right? That's for advanced degree candidates, typically kicking off in the spring, for undergraduates, sort of in the summer into the fall, sort of timelines. And then, in terms of your background, by the way, once you're here, our general philosophy is we can take people who are passionate about the life sciences and interested in it, and then teach you more of the business aspects as you go. Doesn't mean you need to have an MBA, doesn't mean you need to have a PhD, but you need to have the passion and the interest, and we can sort of teach you the rest.
Love it. Okay, thanks. Lane, go for it.
Yeah, it's actually a pretty similar answer from the L.E.K perspective. So most of our hiring is directly out of advanced degree programs or undergrad programs. So for those that are, I think the question is more about people that are in the industry in a clinical care setting looking to transition into consulting. I think one of the key things would be showing a demonstrated interest in business and finding a way to kind of get that on your resume one way or another via some bridge program with an MBA school or an internship or a volunteer program that you're doing with a business where you're advising them on the side of your clinical care work. I know that is a lot to ask, but having some level of experience, exposure, and demonstrated interest in business, I think, is critically important. And then, of course, preparing for and networking for into those interview programs, because the interview really is ultimately where the job offer comes out of.
Love that. Thank you. Amazing. Awesome. So next question, how do your firms typically value an MBA with healthcare industry experience, but without a scientific background? So again, touching a little bit on some of your backgrounds. Greg or Todd, do you want to take this one?
Sure. Yeah. I mean, I think that's a huge benefit. I mean, just like I talked about before, how much we value depth, on the bench and, for PhD students, folks who have industry experience, either because they were a clinician in a hospital, not just physicians, so NPs, physical therapists, things like that. We hire a lot of those, but also people who were administrators within hospitals or worked for payers or worked for healthcare companies in a variety of roles. We think those are great because I think they can speak to the experience and the priorities, not only of our customers, but also our customers' customers, and which is ultimately what we need to really understand. So hugely valuable, just as much or more than true scientific experience.
I thought you were going to say that MBAs have no depth. We like you value people with no depth. I thought that was right. Where you were going with that. I'm an MBA, so I can say these kinds of things. Love it. Great, Todd. Did you want to weigh in on anything else for
Sure.
that?
I mean, I think with the MBA students that come out these days, there's obviously a huge level of intellectual horsepower that can really help people and companies think through strategic problems and challenges and opportunities. And I think additionally, most MBA programs these days are really structured around team leadership and getting things done collaboratively. So I feel like an MBA coming out can really sort of come into our firm as a project leader or program leader and really work with the leadership team and collaboratively get something across the goal line, as well as be that intellectual on the bigger strategic debates that they're having at the team.
Love it. Last question, and this one is for Greg. How will the intersection of value-based care and private equity affect the healthcare ecosystem in the future?
Sure. Yeah. So prior to Health Advances, I worked at a firm called Arcadia, which was all about using data to help payers and healthcare systems operate more effectively under value-based care systems. And my somewhat sarcastic answer is, if I could predict the pace and the destination of value-based care in the United States, I would have founded a company and made a huge impact on the world. So I think one of it is it's a little bit of a cautionary tale of trying to predict exactly where that intersection is going is really, really hard, because it is so dependent on not only policy at the federal and at the state level, but also on regulatory aspects from the FDA and the ONC and CMS, but then also really where private equity investors are seeing opportunity. And so I think where it's really going is looking at the investors and the companies that are not just saying, hey, we have the magic solution to when we are all in a fully value-based care world, because anyone who says they can predict when and where that's going to be is lying. But those that can have a really clear story on how to manage the transition from where we are now to whatever our value-based care future is, those are the ones that I think generally know what they're talking about, and if they have the flexibility in capital, in technology, in services to just stay a little bit ahead of where we're going and help drive the industry, that's where I think the opportunity and the money's going to be.
Greg, obviously, a lot of people will know what value-based care is, but maybe I should have started by saying, can you describe what value-based care is for those of the folks on the call that might not know what it is?
Yeah, so we could probably spend an hour on that, but the really simple answer is right now the American healthcare system largely pays for care in a fee-for-service model where you get paid a certain number of dollars for every test you run, every surgery you do, things like that. Value-based care is fee for value. So you pay a certain amount of money for a certain set of procedures or for a certain patient. So as opposed to saying, I will pay for whatever care Greg Chittum needs over the course of the year, you say, I will pay you $5,000 for Greg's care. If you keep him healthy and he only needs $2,000 worth of care, you made $3,000 worth of profit. But if he gets really sick and it costs $15,000, well, you're on the hook for the additional $10,000.
Love it. Thank you. Great. We have about 2 remaining minutes before we do closing statements. Does anybody want to weigh in on those questions that were asked so far, or a question that you didn't hear asked that you think would be valuable to add some insight on?
I'm happy to weigh on one that I saw thrown into the chat. There's a question on I think diversity and DE&I. I think this is definitely something we face a big challenge with. I mean, honestly, in our industry, in healthcare, it is, life sciences in particular, not a particularly diverse industry. It's not a particularly diverse sort of set of skills. But, I think one of the big things that I'm sure everyone on this call can attest for is the industry has grown rapidly over the past decade or so. And now there's, a real question of where are we going to find all the talent that we need? And part of that then is concentrating on places beyond where we've historically looked, right? And so for us, spending a lot of time there and then spending a lot of time on, once folks are within ClearView, within our organization, it's not just, the diversity part, it's the sort of equity and inclusion and sort of the feeling of belonging that our team has spent a lot of time on. Can't claim to say that we're perfect on it, but certainly an area where I know everyone is spending and focusing a lot on.
Well, just quickly, another question that I saw pop up in the chat is people saying, well, if I want to get into healthcare, what are some of the skills that I need to develop? And I would just say to that, the number one skill is really problem solving. And it's it's developing the mindset of, I'm going to figure out a way to solve this problem, even though I'm moving from a world with pristine data, where in research, to a world in consulting where data is not there typically. And so being able to come up with creative solutions and sort of have I'm not giving up, and I will figure out how to solve this problem and do it so efficiently. That's the number one skill set. If you have that, we'll hire you. I don't care what other background you have.
You heard it here. Take it to the bank, right, Rob?
Right.
I love it. Okay, amazing. Well, now I think we'll move to closing questions. Thank you all. I feel like we could really extend this conversation. You have dynamic insights, really different perspectives. But as we conclude, what is one piece of advice that you'd offer to folks that are looking to break into this field, as well as feel free to share with your minute anything else that you didn't get a chance to share today? We'll move in reverse order from how we started earlier. So let's see here. Let me just go back to my list. So Todd, you first.
I think dive in with both feet and get into the industry, and then figure out what you want to do. I wouldn't spend too much time trying to find the perfect fit before you get in the industry. get in, build relationships, get some good wins in your experience base, and then learn and go from there.
Love it. Great advice. Stacks, Rob.
Yeah, my advice is similar. Dive in, get a role that you like, or get a role that that's available that you can get. Ideally, you want to get
Yes.
ideally you want to get a general role, I suppose, so you can kind of get a good feel. But even if you go very specific initially, you can always move around later. The number one thing is have a really good attitude. Have a I'm going to be the solution for my team attitude, and then keep be aggressive at making lives better for the people in your team, and you'll move up quickly, and you'll find lots of opportunities. That's the number one advice is believe you can get in, and you can make it happen.
We got to get a t-shirt that says that. Come on, you're full of inspo today. I love it. Lane, how about you? What do you want to say to all these folks?
Yeah, I mean, it's a good question. There's been some good comments already. I think maybe spend some time thinking about what you want to be famous for. Don't take a short-term view, right? There's the next role you're going to get, but ultimately, where do you want to be at the apex of your career? What do you want to be doing when you retire? And it's probably not going to play out that way, but if you've got a vision and a perspective about what makes you unique and what you can be famous for down the road, I think that'll make you a lot more interesting in your interviews, and in the discussions you have with the people that you're networking with. Even if down the road you end up pivoting away from that, just have a perspective, have a point of view, think about what makes you unique, and what ultimately you're striving for around, being famous for something someday that's going to drive you to where you ultimately want to be in your career.
Lane, that's leading me into a lot of introspection. I don't know if I can handle this much on a Tuesday afternoon, but I do have a question for you. Is this where you thought you would be? Is this what you hoped to be famous for? Is this kind of where you started? Is there another piece of your process that's still a part of your vision?
Well, I did a lot of introspection when I went back to business school for that period of time. I tried to keep a very open mind. I talked with all my classmates who'd done other things. I had lunches with different executives who visited the campus. I did the full recruiting program, did an internship, did lunch and learns with companies. I really tried to think about the broad spectrum of where I could end up and where I want to focus in the long run. I ultimately did decide to go back to L.E.K at that point. And that was for a lot of the reasons we've talked about around team-based problem solving. I really wanted to work in a collaborative environment. A lot of the other opportunities I looked at were more individual contributor-based career paths. And so for me, that was a big deciding factor. I think also just being able to work with so many different companies. And like I said at the start, the clients being super passionate about what they do and helping them realize their dreams. And so for me, that was a big motivating factor. And so this is where I plan to be at this point, and probably ultimately till I retire. But at one point, I did have a much more open mind about what I wanted to do, and did an internship in business development at a biotech company, and did explore a number of other options, which are all great options. But for me, this was a good fit. I don't know that it's necessarily a perfect fit for everybody in the long run. And certainly I have a lot of clients who have found, wonderful roles in industry, and I'm very glad that they're there. But for me, helping them is ultimately where I fit best.
I love it. Thank you. Deep perspective. Appreciate it. Greg, what about you?
Yeah, I would say, as you think about sort of the interview process and the networking process, I think the most important thing is really be unique, be interesting, be authentic. I think the only thing in my experience worse than someone who's underprepared for an overview is someone who's overprepared, and you can see them going through the algorithm of how to deliver the perfect case interview response, and you can tell they're not actually being themselves. They're not actually thinking, they're just going through a process. And those are the people that you immediately know this is not going to be a good fit. So really try to, and I think Lane referred to this, like really the more you can be interesting in an interview and have something that stands out, that's not necessarily just about how well you responded to the case, is what's the most important, both for your getting the job and for being happy at the job. Because as I think most of us have said, the teams we work with is what keeps us in this industry.
Love it. Thanks, Greg. Last but not least, Kai and the magnificent ClearView partners.
Yeah. Yeah, thanks. I mean, I don't have much to add to all the answers there. I think I'll come back to the one on sort of attitude and really wanting to want it. I think as everyone here can attest to, consulting is not an easy job, and what makes people enjoy it, get the most out of it, is working with teams to do sort of challenging things, and then getting to enjoy working with those folks. And so having the right mindset and mentality coming into it, I think, is 85, 90% of it. And then, the rest is the knowledge base, the skill set, right? But those are things you can learn and develop over time. The attitude is not. And so approach it with that mindset, develop the viewpoint, develop your perspective. But yeah, that's all I'd say.